Welcome to the Business Profile. I'm Jeff Layton, and today we're at the Whitney Sleep Center, which is in a new location right on the corner of Washington Avenue and Highway 10 in Detroit Lakes, what a lot of people know as the Greystone Building. And with me is Sue Gunwale. Now, Sue, I'll tell you what, when I walked in here, wow, fabulous facility.
Yeah, we're enjoying it. It's been completely remodeled. We actually had to do some build-outs, some sound barriers, new countertops, paint, flooring, the whole works. It's been fun.
Well, I tell you, somebody, and I know that you played a big role in it, took a lot of tender, loving care for this place. It looks great. Let's talk a little bit on your background, first of all, and how a little bit you got into this.
Okay. Well, 15 years ago, I'm a nurse by trade. Okay. And in the early 90s, I worked at St. Mary's Hospital. And there was a position opening at Country Health. And I was head of their respiratory, being CPAP and BiPAP, which is the treatment for sleep apnea.
Okay.
So it's been a total of 15 years that I've been working in this field. I went to work for a business in Fargo and then for Dr. Whitney. Okay. And started this program.
All right, so now that gets us to the name, Whitney Sleep Center. So tell us a little bit about the background of Dr. Whitney, and obviously that's where the name of the facility comes from.
Dr. Whitney is an internal medicine physician, and his passion has always been sleep medicine. Okay. And in 1995, he graduated with his internal medicine degree. He then, in 2003, went on to school for sleep medicine. He did a fellowship, mentorship, and then in 2005 became accredited or credentialed as a sleep physician.
Okay.
His passion is rural outreach, and he feels that the rural areas are very underserved as far as sleep medicine goes. There are 84 known sleep disorders. So
84. Now,
84.
Who would have? I would have thought there's half a dozen or something, but 84.
84.
Wow.
Yes.
Okay.
Yeah.
And so he's then able to really pinpoint through these sleep studies, which we'll talk about a little bit more, exactly then what for an individual the best course of treatment would be.
That is correct. However, the sleep history plays a very important role because in this day and age with the stressors, work stressors, family stressors, there's so much insomnia. So there's really a lot of twofold when it comes to the diagnoses of sleep disorders.
All right, well, we're going to get a little bit more into that in the second half here, and then we're also going to have a nice little tour of the facility and tell people what they can expect when they see here.
Okay.
So we'll be back right after this.
A bad night's sleep can have an adverse effect on a healthy lifestyle and positive relationships. With over 84 recognized sleep disorders, trust the experts at Whitney Sleep Diagnostics and Consultants to figure out what's causing you to lose sleep. No need to travel. Visit Dr. Whitney and the staff of clinical specialists at their new location in the Greystone Complex in Detroit Lakes. No referral necessary, and Whitney Sleep Center contracts with all payers. You deserve a great night's sleep. Whitney Sleep Diagnostics and Consultants for uncompromised patient care.
Welcome back to the Business Profile. Again, we're at the Whitney Sleep Center right in downtown Detroit Lakes, corner of Highway 10 and Washington Avenue. The Greystone Building, fabulous new facility here. I want to congratulate you, Sue Gunwale, again with us. Now, Sue, when people walk in, give us a quick little tour of the Whitney Sleep Center.
Well, when you walk in, you're going to walk into our medical equipment division, where we have our scheduling and our intake coordinator there. We can help you with your medical equipment needs, with your sleep needs, make an appointment with Dr. Whitney. You can come in, ask questions, see a clinician, a CPAP specialist, and we can help you with any of your questions. We have then on the other side our sleep center, and we have 2 rooms. We can study 2 patients a night where the technician comes in and you're hooked up to 21 leads. I know that sounds awful, but it really isn't. Most all of our patients sleep well.
Okay. So, yeah, that's one thing that you not only do the actual testing here, but you can actually, if you have a CPAP machine or if you're in need of one, you also have the equipment side.
That is correct, yes.
Okay. All right. Well, one thing, I'll just do a little sideline here and tell you a little bit about just a personal story. And that was with my dad about 20 years ago, and I know this was fairly new back then. And he went in for that sleep study, ended up getting one of those machines, the breathing machines, and he gained honestly 10 years of energy. It was overnight. I just remember he'd come home, sit down in the chair, fall asleep, get on an airplane, he'd fall asleep. We worried about him driving because we thought he'd fall asleep.
Yes.
So I know just from firsthand that this is a really neat thing for people.
Yes, it is. It's very personal for me as a nurse. Many patients that have, it hasn't only saved their marriage or their family life, but it has also created wellness and quality of life. So for me as a nurse, that's been so rewarding.
Okay. What's the easiest way for somebody to get a hold of you? Is there a phone number, or what's the best way?
Yes, 844-6150. Long distance would be 877-844-6150. Or we're right on the front of Washington, on the corner of Highway 10 and Washington.
All right. Well, fantastic, Sue. Thanks for having us in.
Thank you.
All right. Until next week's Business Profile, I'm Jeff Layton.